Hey guys, okay, so in this injury breakdown, it's on Olecranon Bursitis, and I know those are big terms. So Olecranon is a fancy way of saying your elbow, and bursitis, we'll break it down a little bit. So itis means inflammation, which is swelling, heat, altered sensation, pain, redness. So that's basically in the breakdown of that part of the word. Bursa is part of the structure in your body. So imagine you've got these fluid-filled sacs, and they're kind of like buffers that are kind of placed around the joints, and they're basically allowing the joints, when they move, when they straighten and bend, to slide and allow the bones to move with ease. And your body is amazing. It does try to get you moving efficiently. Sometimes it doesn't do a great job, but it tries. And so an olecranon bursitis happens when you have a fall and you land on your elbow and you hit the bursa. So basically, you've aggravated that fluid-filled sac and you went bang, okay? And it just kind of went and blew up. And I know that's the best way I can explain it with one-handed. So anyways, so basically that that sac that was like, say, this size is now this size. And so they're placed all over your body, like your knees, your hips, all over, okay? Areas where your joints need to move. And so when you've aggravated it or you've hit it, it ends up being inflamed, right? When it's a bursitis, you're gonna have pain, swelling, redness, reduced range of motion. Worst case scenario, some people, if they hit it, if they did a really good job, and I've seen that in the past, it needs to be aspirated. So what that means, I know so many big terms, you would need it aspirated if the swelling was so much, it was so excessive that you couldn't even bend the joint. And so that's worst case scenario. And sometimes if you've hit the bursa like bang on, you'll have like a perfect circle as well. It's weird. But that being said, not all of them are, not all bursa are created equal, right? So, I mean, it's a hit and miss, but don't hit. So you do want to be careful if you were to fall on the ground, land on your elbow, because if you inflame that bursa, it can be quite uncomfortable. So what you'll basically do is apply ice. You're gonna wrap it up you could use a compression bandage, wrap it up, keep it nice and snug, and your doctor, you'll want to definitely see your doctor just to rule out any fractures. And yeah, you'll want to do ice, so peer principle. You'll want to get the anti-inflammatories from your doctor so they can help to reduce your body's healing process so that all that swelling will settle down. And yeah, it may have to be aspirated. Some people have to go back a couple of times. It just depends. So just make sure that when it comes to elbow injuries, that you do take good care of yourself, because those ones are tricky. So definitely take care of yourself. And worst case scenario is, say you get an infection. Well, you really want to get that checked out. So that's worst case scenario. But for the most part, they do settle down on their own. And once you calm down the pain and the swelling, it'll settle down. But if it's really severe in the swelling, then definitely get that aspirated. So go visit your doctor, either your family doc or sport med doc, probably sport med doc, just because they'll have more, they'll probably have more experience with that, but you can still see your family doctor and get that taken care of. So best of luck, and hope you learned something. Bye guys.